Hi students, it's me again, Nanette Solveson, and we're going to begin our first section of exploring healthcare careers. So this is part one, exploring healthcare careers, and if there is anything at all that you take away from this section, I want you to remember that it's not just doctors and nurses. It's so much more than just being a doctor and a nurse. So in part one, the title being You Have Choices, these are the student learning outcomes. And I think it's helpful to know what the student learning outcomes are before we start the chapter or the section, so that you can keep your ears open for certain words. So the student learning outcomes are, the students will describe the difference in a healthcare team member that one, provides direct patient care from one that provides imaging and diagnostic testing. So for example, x-rays, blood tests, and so on. And the second outcome is students will name one profession that functions in a support role and describes how how they support the larger healthcare team. And as a thought question, keep in your mind as we go through this, that it's critical to be a good communicator if you work in healthcare. Given what you know or you're about to learn about how healthcare teams work together, why is communication so important? So this is it's a short list, it's an incomplete list of some of the healthcare professions taught at community colleges. And I'm going to walk through those for you now. The first is dental hygiene. And I'm going to go over these in no particular order. Dental hygiene, there are multiple dental hygiene programs in the Bay Area. We are very lucky. One of the programs in the Bay Area, the dental hygiene program, actually offers a baccalaureate degree. So that's it's a very cost-effective way to get your bachelor's degree. So you should, if that's important to you, you should keep that in mind. We have several pharmacy technology programs in the Bay Area. One of the pharmacy tech programs is actually consistently in the top 10 rankings of pharmacy technology programs in the whole United States. And for several years, the program was ranked as #1. Radiologic technology, this is a very popular discipline in the Bay Area. We have many programs in radiologic technology. And students really seem to love that profession. We have certified nursing assistant programs, licensed vocational nurse programs, medical laboratory technician program at De Anza College. There's actually only one medical laboratory technology program in the Bay Area. There are several paramedic programs. There is an orthotech program. There are multiple emergency medical technician programs in the Bay Area. There's one physical therapist assistant program at Ohlone College. There are community health worker programs all across the Bay Area. There's one sonography program. It's at Foothill College. It's a general sonography program. There's multiple dental assistant programs in the Bay Area, and at least one of the dental assistant programs has been awarded, again, in the top 10 dental assisting programs in the whole US, and a couple of years they've been ranked as #1. We have a surgical tech program. We have 18 nursing programs in the Bay Area. We have many medical assisting programs. We have multiple respiratory therapist programs. And like dental hygiene, we have one respiratory therapy program in the Bay Area that offers a baccalaureate degree. And then we have home health aides. I just want to point out before we leave this slide that this is not a complete list. There are other professions taught, other healthcare programs that are offered at community colleges. This is just a representative list. So given all of these choices, all of these different careers, how do you think about all of these professions? How are you going to begin in your mind putting all of these different professions into buckets so that you can begin to think about in a more useful way which careers you might want to pursue? Healthcare professionals work in teams. And I think one way that will be the most helpful is let's think about the disciplines in the context of a healthcare team and explore how the team works together in different settings. So let's start here. Oops, sorry, excuse me. If you were very sick, where would you go? So if you were very sick, I think everybody would know that you would call 911 and you would go to the emergency room of a hospital if you were very ill. So let's talk about what happens when you go to the hospital. So the title of the slide here is I'm sick and I'm going to the hospital. Imagine the clinical role that you play in my healthcare team. So let's imagine that you're a healthcare provider and you're going to try to help me get better while I'm in the hospital. What role would you be more comfortable playing? And I'm going to talk about all the roles here. So what you can see here is I've broken the roles into 3 different buckets here. And I'm entitling them with what they do. So the first bucket here is entitled in red letters, what's wrong? And the people who work in the hospital or in the emergency room, in the hospital actually, whose job it is to sort out what's wrong are the people who are going to do imaging and diagnostics. So those are the healthcare workers that do the x-rays, the sonography, they do the EKG testing of your heart, they do medical MRIs, they may work in the laboratory running clinical tests. So when you have blood drawn, that blood goes to the clinical lab and they run all kinds of assays to find out if you have an infection, if you're anemic, just a variety of things. You could have a nuclear MRI test and of course x-rays. So if you're part of the team that determines what's wrong, you're working in the area of imaging and diagnostics, and you are likely to fall into one of these categories. Now, the second bucket are the group of people who really help me improve. So I'm sick, I'm in the hospital. Who's going to help me improve? All the information that was collected from the people doing the imaging and diagnostics get funneled to the head of the healthcare workforce teams, usually the doctors, and they will decide on a diagnosis, what's wrong with me, and tell the people involved in direct patient care what the direct patient care individuals need to do to help me feel better. So the people involved in direct patient care are the people who see the patients every day, who check on them, give them their medicines, check their blood pressure, check their temperature, ensure that all of the doctor's orders have been implemented, perhaps give breathing tests, help you walk, and so on. So those are people involved in direct patient care. And the kinds of professions who do direct patient care are nurses, respiratory therapists, physical therapist assistants, certified nursing assistants, licensed vocational nurses. Now, I'm talking about these as 2 distinct buckets, right? I'm talking about them as if they're two totally distinct and separate groups, but they're really not, right? There may be some radiologic technicians who do interact with patients, and you might see them, but they're not people who are going to be on an hour by hour, day to day providing direct patient care. And there are many other people who can provide direct patient care in addition to these people that I've listed. So these are not 100% complete. Now, in addition to these two buckets, there's a third bucket that I'm calling the support team. And these are the people who work behind the scenes to make sure that the imaging and diagnostics and the people involved in direct patient care have the support that they need to fully support the patient. So for example, a pharmacy technician is somebody who might be in this group. It's not likely that if you were in the hospital, you would ever see the pharmacy technician, because the pharmacy technician makes sure that your medicine is ready and delivered to the nurse so that the nurse or some other person on the floor is able to give you your medicine. So you wouldn't see the pharmacy technician, but they have a vital role. They need to be sure you have the right dose of your medicine, that it's there on time. And so they have a vital role to fill. The dietitian is there ensuring that you have nutritious food, but you likely are never going to see the dietitian. There may be a social worker involved at the hospital who is planning for your discharge from the hospital. Where will you go? Are you going to have to go to assisted living? Do you need physical therapy training? And so on. So they may be involved quite a bit in your successful re-entry back into your normal post-hospital life. And then if you've had any surgery, there's a very important person called a surgical technician who's responsible for autoclaving all of the tools that are used in your surgery to make sure that everything is done sterilely. So you can see there are a lot of people involved in the hospital. And this is part of the new vocabulary that I want you to begin to use to think about the kind of healthcare professional that you would like to be. Would you like to be in imaging and diagnostics? Would you rather be in direct patient care? Or would you like to work behind the scenes on the support teams? All of the individuals play vital roles, and they are part of a larger healthcare team that is highly integrated and very communicative to ensure the safe treatment of patients and the quickest recovery time. Now let's take a step back. I said we were going to talk about the emergency room, right? So somehow you got to the emergency room. You were very sick. You got to the emergency room. How did you get to the emergency room? Well, there's a whole process that's called pre-hospital health care. And that's what we're going to talk about now. So this is the pre-hospital care. So a support team member of the pre-hospital care is called the 911 dispatcher. So most likely, in the course of getting to the emergency room, someone called 911 and asked for an ambulance to be delivered to pick you up. And when you call the 911 dispatch, when you dial 911 on your phone, someone answers the phone and they want to know where you are, what's the situation, give them a little bit of history. They want to know if you've got any drug allergies and so on. And they take that information and they communicate it to the ambulance that is going to be sent to wherever you are. So this is a support team member. You're never going to see this patient. You're never going to see this person. And once they tell the ambulance to come, you'll never hear from them again, right? But they're a very important part of the team. They're vitally important in collecting information from you about where you are, how sick you are, if you have any drug allergies, and so on. That information then gets transported to an ambulance, and the ambulance provides direct patient care. So on an ambulance, you have a paramedic, you may have an emergency medical technician, and you may or may not have a nurse. Nurses sometimes are on ambulances as well. Almost always though, you'll have a paramedic. Now, The role of the ambulance is not to provide real long-term care, right? The purpose of the ambulance is to stabilize you and transport you to the hospital or wherever it is you need to go. So they have a very different role. You can imagine that there's very few diagnostics and imaging done on an ambulance, right? They don't have a big X-ray machine in the ambulance. So there's very little diagnostic and imaging that goes on in an ambulance. If they suspect you're having a heart attack, they may do an EKG, which is a diagnostic. So there is some, but nothing like what happens at a hospital. So most of what happens in an ambulance is direct patient care. And I've already told you that a paramedic, EMT, and nurse can be on the ambulance. Now, this is a summary slide that has everything in it that we've already talked about. So I'm going to get very messy, but I'm going to go through it slowly. So this title is Healthcare Workers Are Huge Teams, right? So we've just talked about the very simple, scenario of someone going to the hospital, right? So there's two stages of this. If you draw an imaginary line here, in blue, this is the pre-hospital part. This is before the ambulance came and took me to the hospital. So this is called pre-hospital. The support person in the pre-hospital phase is the 911 dispatcher, right? They're the person that you call to get you there. They're a support person. The people who are responsible to stabilize and transport you, those are people involved in direct patient care. Those are the paramedics, EMT, and nurses. Now, once you get to the hospital, this is now what's happening when you're in the hospital. The support people are the pharmacy technicians, the dietitians, social worker, and surgical techs. The people who are sorting out what's wrong with you are doing imaging and diagnostics, and they are radiologic technologists, sonographers, and laboratory techs. They're trying to figure out what's wrong. The people in the pre-hospital phase are trying to stabilize you and transport you. So they have very different goals. And then the last phase here is the help me. How are you going to help me get better? These are people involved in direct patient care, the nurses, respiratory therapists, physical therapists, and physical therapist assistants, CNAs, and LVNs. Now I have circled here in black people that are involved in direct patient care, right? These are direct patient care careers, and this is a direct patient care career. But I want you to count and see that the majority of people involved in this one scenario were not people involved in direct patient care. So there's 1, 2, 3, 4, 5, 6, 7, 8, 9 people involved in direct patient care. 1, 2, 3, 4 people involved in imaging and diagnostics, and 1, 2, 3, 4, 5 people involved as support, part of the support group. So you can see there are huge teams of people that work in a hospital and in an ambulance that work together as a group, a cohesive and very well communicating group. And I also want you to notice that there are transitions, there are handoffs of patients from one group to the next. So there is a handoff of the patient from the pre-hospital setting when they're in the ambulance to when they're in a hospital. And remember, one of the thought questions is, why do you have to be good at communicating? This transition between a pre-hospital to hospital phase is very important, and all the information about what happened at the pre-hospital stage needs to be correctly transmitted or relayed to the hospital to be sure everybody's able to make good decisions. So the hospital is not the only place where healthcare workers or where healthcare is delivered. You could decide you wanted to work at a skilled nursing facility if you like to be if you like to be around seniors. Often people who work at skilled nursing facilities include nurses and licensed vocational nurses, a dietitian, people who do rehabilitation kinds of work, occupational therapists, physical therapist assistants, and so on. There are also mobile health units that travel around and deliver healthcare to rural areas. And these could include nurses, physician's assistants, doctors, a variety of different people can work in mobile health units. You might also want to work at a private medical doctor's office. And so people who work there can be nurses, physician's assistants, medical assistants, and so on. You may also decide that you want to work at a community health clinic. These are, they are very important parts of communities. They often offer healthcare advice in the language of the community, so it makes them a very trusted and vital part of a community. Often community health facilities employ nurses. They can employ community health workers and medical assistants. You might, if you are interested in oral hygiene, you might become a dental hygienist or a dental assistant, and then you would work in a dental office. If you like the paramedics that I talked about before, you could work at an ambulance company, and some firemen are also paramedics. You may also work at the fire department. Or you may work in a private home. People who are sometimes EMTs, CNAs, home health aides, and so on, sometimes are employed in private homes. So let me move this again. So here is the summary of part 1. You have choices. These are the student learning outcomes. You should now be able to describe the difference in a healthcare team member that provides direct patient care from one that performs imaging and diagnostic tests. Students will be able to name one profession that functions in a support role and describe how they support the larger healthcare team. And the thought question, and I think I gave you a big clue about this, but anyway, you should write it in your own words. It's critical to be a good communicator if you work in healthcare. Given what you know about healthcare teams, how healthcare teams work, why is communication so important? Great job, everyone. We just completed section 1 or part 1 of the course. And I'm looking forward to seeing you in section 2. Thank you.